It's a startling nationwide trend. Suicide attempts among preteens are on the rise. That's according to a study published in JAMA, and the increase started long before the pandemic.
Yeah, investigative reporter Shaley has more on the research and what experts are seeing here in southern Arizona.
We are absolutely seeing this distress reach down into younger and younger kids.
Dr. Hillary McClafferty is the Section Chief Medical Director of Pediatric Emergency Medicine at Tucson Medical Center.
We've had 10-year-old, 11-year-old, 12-year-olds who are coming in with suicidal ideation, suicidal attempts, self-harm regularly.
What is happening in southern Arizona follows a disturbing trend nationwide. Researchers looked at intentional ingestion calls made to the 55 poison centers across the country and found from 2010 to 2020, all age groups showed a rise in suicidal ingestions, but the most dramatic increase was among preteens. According to this study in 2010, the poison centers reported a total of 1,058 suicidal ingestions among 10 to 12-year-olds. By 2020, that number jumped to 5,606, a five-fold increase.
That absolutely corresponds with the rise in social media and the decline in social interaction before the pandemic.
Rebecca Carrier is a coordinator for Tucson Unified School District's counseling department and says she's seen a big change in the way children cope with challenging and stressful situations.
In general, when young people got angry, they would lash out at others in the past. And we're seeing a whole lot more of young people getting angry and lashing inwards.
And Carrier says the pandemic further hindered children's emotional and social development.
They're jumping from I feel sad to I want to end my life, as opposed to jumping from I feel sad to I need to talk to people about this. I need to feel better. I need to find ways to feel better, which when people are constantly interacting with each other, it's a natural, gradual learn, and they missed out on that.
When COVID-19 hit, Carrier says crisis-based referrals increased, with students needing a more comprehensive mental health plan beyond what school counselors can provide.
We are seeing an increase in diagnoses of anxiety, major depressive disorder in younger and younger kids. And it's very scary.
Steve Dudley is the director of the Arizona Poison and Drug Information Center at the University of Arizona. The office serves every county in the state except for Maricopa, which has its own center.
We've seen a small uptick over the last few years, but we really saw a jump, about a 30% increase from 2020 to 2021 in pediatric suicide attempts.
Dudley says kids are turning to over-the-counter pills, their own prescriptions, or the prescriptions of family members to try to take their own lives.
You're seeing this level of trauma and depression and other hits on the mental health and well-being at such a young age and consistently. That's the other problem, that it's really alarming. It's really crying out for help.
According to the American Association of Poison Control Centers, in 2020, Arizona callers contacted the Poison Control Centers 3,680 times for exposure in children between the ages of 6 to 12. 8% of those calls, or 299 cases, were categorized as intentional exposure to a substance. In the 13 to 19 age group, 2,639 cases, more than half of all exposures, were intentional.
No one is actually required to report anything to the center.
Right.
So would you say the numbers that you have are probably low?
Oh, it's for sure underreported. Yeah, absolutely. It's actually a pretty alarming trend going on, and that's why we think it's really important to address what we can do about that to stop this.
Rebecca Carrier with TUSD says they are seeing more acceptance for mental health concerns and feels students are more comfortable approaching counselors and other adults at school, which could also be contributing to the increase in diagnoses. Still, the numbers are concerning, and these healthcare professionals are pushing for more educational opportunities and resources. Shaley Sanders, KWD investigates.